Coming to question 36. A 40 years old female patient came with complaints of chest pain, palpitation and shortness of breath. On examination, pulse was 102 per minute regular, BP was 100 by 80, JVP was elevated with a prominent A wave. So this is a very important clue. Elevated JVP, the prominent A wave. Prominent A wave, or we can say it is a giant A wave. On auscultation, S1 was loud. This is the next clue. Opening snap was heard and mid-diastolic murmur was heard in the mitral area. So clearly we can make out that it is some valvular heart disease. So we have learnt about this diagnosis in our clinical days. So clearly mid-diastolic murmur in mitral area, opening snap, all this point towards the mitral stenosis. So we'll make some discussions here. See, among valvular heart diseases, the only valvular heart disease with loud S1 is pure MS. The only valvular heart disease with loud S1 is MS. So all other valvular heart diseases will have a soft S1. Okay. Loud S1 and opening snap go together. So if opening snap is given, then also the diagnosis is mitral stenosis. If loud S1 is given, in the context of valvular heart disease, it is loud S1. Now about the murmurs. So we have only 4 important valvular heart disease: aortic stenosis, aortic regurgitation, mitral stenosis and mitral regurgitation. So in which area should you auscultate? For aortic stenosis, we have to auscultate in the aortic area. That is in the right second intercostal space. For aortic regurgitation, it can be heard in the aortic area, but it is better appreciated in the herbs area or the second aortic area. So which is in the left third intercostal space. So this is where you auscultate. Mitral stenosis and mitral regurgitation, it is better heard in the mitral area. So where is mitral area? At the apex of the heart. Now what murmurs do you hear? So remember, in aortic stenosis, there is a stenotic valve between left ventricle and the aorta. So when the left ventricle tries to pump blood during systole, there will be turbulence across the aortic valve. So this is a systolic event. Aortic stenosis is a systolic event. What about aortic regurgitation? There is incompetence of valve between left ventricle and the aorta. So when the left ventricle tries to relax, normally the aortic valve should close to prevent any backflow of blood from the aorta. But in aortic regurgitation, due to incompetence of the valve, blood comes back from the aorta to the left ventricle. So aortic regurgitation is a diastolic event. What happens in mitral stenosis? Normally blood flows from the left atrium to the left ventricle through the mitral valve. When mitral valve is stenosed, during diastole, blood finds it difficult, or there is turbulence of flow when blood flows from the left atrium to the left ventricle. So mitral stenosis is a diastolic event. What happens in mitral regurgitation? So during left ventricular diastole or during left ventricular relaxation, during left ventricular systole, when the left ventricle contracts, the mitral valve should close so that blood does not go from the left ventricle into the left atrium again. But if the valve is incompetent in mitral regurgitation, blood flows from the left ventricle to the left atrium. So mitral regurgitation is a systolic event. I'll put a box diagram. This is right atrium. right ventricle, left atrium, left ventricle, SVC and IVC empty into the right atrium. Right ventricle becomes the pulmonary artery and supplies the lung. From the lung, 4 pulmonary veins come back into the left atrium, and blood flows from the left atrium to the left ventricle. Left ventricle pumps blood out through the aorta. So I told the two important valves are mitral valve and aortic valve. So mitral valve is between left atrium and left ventricle. Aortic valve is between left ventricle and the aorta. So what happens in mitral stenosis? There will be turbulence of flow when blood flows from the left atrium to left ventricle. So when does blood flow from left atrium to left ventricle? During ventricular diastole. So mitral stenosis is a diastolic event. So what happens in mitral regurgitation? Mitral regurgitation is leakage of blood from the left ventricle to the left atrium during ventricular systole. So MR is a systolic event. What is aortic stenosis? There is turbulence of blood flow when blood flows from the left ventricle to the aorta during systole. So it is a systolic. AS is a systolic event. What is AR? Is turbulence of flow when blood comes back from the aorta into the left ventricle during diastole. So AR is a diastolic event. So likewise we hear murmurs like that. So in aortic stenosis we have ejection systolic murmur. In mitral regurgitation we have pansystolic murmur. In aortic regurgitation we have early diastolic murmur. In mitral stenosis we have mid diastolic murmur. So if you see aortic stenosis and mitral regurgitation both produce systolic murmur. Aortic stenosis produces systolic murmur in the aortic area. Mitral regurgitation produces systolic murmur in the mitral area. MS and AR all produce diastolic murmur. MS produces mid-diastolic murmur in the mitral area. AR produces early diastolic murmur in the aortic area. So these are the 4 common valvular heart diseases and the common murmurs which are heard. So diastolic murmur, opening snap, loud SON, everything point towards mitral stenosis. One question was asked in 2024, that is, patient same with mitral stenosis but he presents in AF. What will be the JVP finding? Remember, we know very well that JVP has 5 waves. The positive waves, A wave, C wave, then the X descent, and the V wave and the Y descent. Okay. So what does A wave indicate? The capital A stands for atrial contraction. When does atrial contracts? Atrium contracts for only 0.1 seconds at the last part of ventricular systole. So you would have ventricular diastole, sorry. So we would have read in cardiac psych. The ventricle contracts for 0.3 seconds, ventricle relaxes for 0.5 seconds. In the last 0.1 seconds of the ventricular diastole, the ventricular filling is accentuated by means of left atrial contraction. That contraction is measured in JVP as A wave. So why in mitral stenosis we have A wave? So we know the dynamics. In mitral stenosis, we'll come back to the box diagram. In mitral stenosis, there is stenosis of the mitral valve. So there is turbulence of blood when it flows from left atrium to the left ventricle during diastole. As a result, left atrium becomes dilated. So the back pressure gets transmitted to the pulmonary veins. The back pressure gets transmitted to the pulmonary capillaries. There will be leakage of blood leading to pulmonary edema. When chronic pulmonary edema, there will be hypoxia and hypoxia causes vasodilatation everywhere except in lungs where it causes vasoconstriction. So the pulmonary artery go for constriction. This leads to pulmonary hypertension. When pulmonary hypertension occurs, the right ventricle finds it difficult to pump blood. So right ventricle goes for hypertrophy to overcome the pulmonary hypertension. When right ventricular hypertrophy occurs, blood regurgitates from the right ventricle to right atrium. So this is regurgitation from right ventricle to right atrium occurs through tricuspid valve. So this is called a secondary tricuspid regurgitation. Secondary TR. So again right atrium dilates. When right atrium dilates, remember JVP is measured in the internal jugular vein, which is a continuation from the right atrium. So we have AV dilated. So pure left-sided events will not cause JVP elevation. Right, left-sided events, when they cause or when the pathology extends to the right side of the heart, then only JVP changes will be there. But primary right-sided heart diseases like constrictive pericarditis, pericardial tamponade, pulmonary stenosis, tricuspid stenosis, etc. also will cause A-wave changes. So to be frank, giant A-wave can also occur in tricuspid stenosis. It can also occur in pulmonary stenosis. It can occur in right ventricular hypertrophy. It can occur in pulmonary hypertension. And regarding a left-sided event, mitral stenosis causes the same pathogenesis, because when mitral stenosis extends, it will cause pulmonary hypertension, right ventricular hypertrophy. It will cause TR, and the pressure backflows and A wave becomes big. Okay. So giant A wave is also one feature of mitral stenosis, even though it is not even though physiologically only right-sided events commonly cause it, left-sided events can also cause JVP changes during the late stage of the disease process. So in this video, we discussed something about the murmurs and basic pathogens of valvular heart diseases. So every year in NEET, at least one question comes on some pathogenesis of valvular heart diseases. We discussed one question on ASY versus AR difference, and this question is about MS. Another question that was asked in NEET was from mitral stenosis. Patient with mitral stenosis, when they present with AF, what happens to the A wave? A wave disappears in AF. Why? Because in atrial fibrillation, the atrium actually do not contract well, they only fibrillate. So the pressure from the right atrium is not transferred to the internal jugular vein. So A wave is absent in atrial fibrillation. This was also a question.